Hey everyone, welcome to my channel Lenovate. Today we will going to discuss the mandible. The mandible is the largest and the movable bone of the human skull. As it has the ramus, which has the two parts or the condyle-like processes that articulate with the mandibular fossa of the temporal bone on the skull. I will show you how the articulation take place. Going to articulate with the temporal mandibular fossa on the temporal bone like this, and in this space the head of the mandible going to attach and form the temporomandibular joint, which is the movable joint of the skull and that can open or close the mouth, elevate, depress the mouth, or somewhat rotation of the mouth can occur. So mandible has the two parts, that is the structure of mandible consisting of two parts. This the anterior part you can see here is the body of the mandible, which is forming the anterior part or the external surface or the lateral surface of the mandible. The body of mandible has some features which will be discussed, while that the other part of the mandible is the ramus of mandible. This elevated part, or you can say the vertical part that is coming from the horizontal body, is called as the ramus of mandible. This is the ramus of mandible, and also the ramus of mandible have the external part or the internal or the medial surface that is shown here, internal or medial surface. So the mandible has one body, that is the horizontal body, and two vertical ramus. On the body of mandible, following structures or the following features are seen. That is, the first is the alveolar arches of the mandible. On the superior surface of the superior border of the body of mandible, we can see the alveolar arches or the sockets for the teeth, that are the 16 teeth that are attached on the mandible. Another thing that we see in the body of mandible is this protuberance. This is the elevated point called as the mandibular protuberance. Lateral to the protuberance, you can see these are the small elevations, and these elevations are called as the tubercles. They are called as the mandibular tubercle as they are present on the mandible, so they are called as the mandibular tubercle that are lateral to the mandibular prominence. And this is the alveolar arches that going for a socket of teeth. These foramens you can see in the mandible are the mental foramens. The mental foramen has a communication with the mandibular canal that will be coming in the internal surface of mandible. From here this canal run, and after passing the vessels from the mandibular canal, they will exit through the mental foramen and become the mental nerve and vessels. Now we will going to discuss the muscles that are attached to the body of mandible. So there are two muscles that are attached to the body of mandible. Here at the level of sockets of the teeth, there will be attachment of a buccinator muscle, and inferior to the mental foramen, there will be attachment of the mentalis muscle. On the ramus of mandible, what structures we can see is the on the anterior border of the mandibular ramus, this is the coronoid process. The coronoid process is the give attachment for the temporalis muscle, and it is present in the anterior border of the ramus of mandible. This process, that is the posterior border of the mandibular ramus, is the condylar part. The condylar part is again dividing into two parts, that is the head of mandible. You can see this rounded elevation is the head of mandible, then comes the neck, and this is the ramus of mandible. So the condylar part and the coronoid part, these both parts are getting attached with each other by a notch like process. This is the large notch, is called as the mandibular notch. One more thing can be seen here is this part. This is the called as the angle of mandible. Because it is joining the body of mandible with the ramus of mandible, this part is called as the angle of mandible, and here there will be attachment of a medial pterygoid muscle. On the ramus of mandible, on the external surface, the muscles attached is the number one is the masseter that will attach on the whole surface of the ramus of the mandible on the external side, while there will be a small attachment of the temporalis on the coronoid process, while the large attachment is on the middle side of the coronoid process of the temporalis. Now coming to the internal side or the medial side of the mandible, what structure we can see in the medial side is, here you can see a foramen that is called as the mandibular foramen, and this foramen will going to lead into a canal, that is a mandibular canal, and exit to the mental foramen. The other structure we can see on the internal side are these lines. The lines that are shown in the internal side of the mandible are called as the mylohyoid line or the myloid line that give attachment to the mylohyoid muscle. On the second ramus, you can see the same structures. And another thing you can see is the lingua of the mandible. The lingua is a bony elevation which is present on the mandibular body ramus on the internal side. This is the bony projection that you can see here is the lingula, and it give attachment to the stylomandibular ligament or some ligaments that are attached to the mandible. So there are again three ligaments that are attaching the mandible and forming the temporomandibular joint, that are the lateral ligament, sphenomandibular ligament, and the stylomandibular ligament. These ligaments and the muscles that are attached to temporomandibular joint have discussed in the separate video. You can see that video and explain well. That is about temporomandibular joint. So from here we can see that there will be a muscle attachment of the masseter outside on the ramus of mandible, buccinator, and the mentalis we have discussed. On the inner side, what muscles are attached on the head of the mandible is the attachment of the head and neck of mandible is the attachment of the lateral pterygoid muscle. The lateral pterygoid muscle is attached on the neck, that is the pterygoid fovea on the neck of the mandible is giving the attachment of the lateral pterygoid muscle. The medial pterygoid will going to insert on this place. Yes, exactly this place at where the angle of the mandible meets with the ramus and the body. There will be attachment of medial pterygoid muscle, and the temporalis we have discussed attached on the coronoid process from the internal surface and coming towards the external surface. And on the external surface you can see this, there will be a masseter and the buccinator and the mentalis. So these are the muscles that are attached. Also the infrahyoid muscle getting attached on the protuberance on the internal side. From here these are muscles that are attached on the internal sides are some infrahyoid muscles. On the mylohyoid line there will be attachment of a mylohyoid muscle. So this is the general structure and the muscle attachment regarding the mandible. Thank you for watching our video.